Hello, Esther. It is time for your discharge, and I wanted to go over this flyer that I'll be sending you home on. It is going to help clarify what your diagnosis is. Now, you were admitted into the hospital with lymphedema that is caused by filariasis. This flyer will help you understand steps that you can take to better care for yourself. And it is nice that we have your husband here, so I'll be talking to the two of you. And anytime you have questions, please feel free to interrupt and I can make things more clear for you, okay? All right, so starting off, what is filariasis? This is a disease that is caused by microscopic thread-like worms that are passed from person to person through mosquito bites. It affects a lot of people. You probably have seen some where you're from. Now, in this flyer, we see a map of the world, and the red areas highlight those areas that are affected by filariasis. And as you can see, Ethiopia falls into that region. So that explains why you happen to have that disease as well. Now, it takes several mosquito bites over several months to years to develop lymphatic filariasis. This basically means that you can get bitten by the mosquito, you get an infection in your bloodstream, and then those microfilariae enter your lymphatic system, and years later is when you get to see the swelling in your leg. Now, for people who live in this area, prevention is key. And how does one prevent themselves from getting filariasis? It is by preventing mosquito bites. Where you're from, you do use mosquito nets, for example, and that's a wonderful way to prevent mosquitoes from biting you. But another way is to wear long-sleeved clothes and trousers, and perhaps to use bug spray. Now, since you have now moved to the United States and are going to make this your home, you don't really have to worry about prevention methods. However, you could share this information with family members that are still back home. The next page of the flyer talks about the signs and symptoms that this disease presents with. Most people who do get infections from filariasis will not even develop clinical signs. The biggest sign that we see is a result of damage to your lymphatic system as adult worms clog up your lymph vessels and cause fluid buildup to happen. Some areas that lymphatic edema will be seen are in the arms, legs, breasts, genitalia, but in your case it's just your one leg. So we're going to talk about steps that you can take to help take care of yourself. This fluid collection can make it very difficult for your body to fight diseases such as cellulitis, which is an infection of your skin, because the skin gets stretched to its limit. There's a wonderful diagram here that shows us the different stages of lymphedema in a leg. This is stage 1, and as it gets worse, the stages go higher. In your case, what stage would you say you're in? That's right, you are in stage 1. And so it is a good thing that you're catching it or coming into the hospital at this stage, because the higher the stages, the more permanent the damage and the more difficult to manage these symptoms are. Another way that the diagnosis of lymphedema takes place is through a blood test, which is what we did for you, and your blood test came back positive. However, some people might have negative blood tests because the filarial worms have long died. They're alive for only about 5 to 7 years, but once the damage is done, the damage will always be there. So let's see what else this flyer has to offer us. Okay, it talks about treatment. Those with a positive test are treated with an antibiotic, and as you can see, the name is pretty long, diethylcarbamazine. This, however, does not kill the adult worms. Since you came in with symptoms such as fever and malaise, in other words, feeling ill, it shows that you had a bloodstream infection caused by filariasis. However, The edema in the leg is caused by the worms, which are not killed by this antibiotic, and so the swelling in your leg is going to stick around for a while. We can, however, do some things to prevent it from getting worse and even perhaps reduce it. So there is some hope. I don't want you to feel like this is it and you're going to forever live with this limp, just like you observed people back home. So after the worms die, the lymphedema develops. However, in the United States, there are specialized clinics that you can get referred to. And in your case, the doctor has written a referral, and I highly encourage you to follow up with them. They will teach you specialized ways to wrap your leg and to care for your leg so as to prevent it from getting worse. This illustration in the flyer shows a nurse or a doctor helping this patient to wash their limb. All you really need is a bucket with some lukewarm water and a mild detergent such as soap. Try to avoid scrubbing it too hard because that skin is quite delicate. Even though it feels a little firm sometimes, it is at great risk for infection. So try to make sure that you wash right in there in between the toes, all the way down the heels, and in any of the crevices that might be formed as the clothing that perhaps you wear pushes on your skin. Another way that you can take care of yourself is to avoid wearing tight clothing, but the lymphedema clinic will really teach you to better care for your leg. Washing your leg daily and then applying a lotion will help moisturize it and prevent it from drying out even more, thus decreasing the risks that bacteria will get in there and cause an infection. Whenever you get a chance, elevate your leg. Say you're sitting down relaxing with family, have your leg up on a pillow. This will prevent gravity from pulling liquids down into your leg and causing it to swell more. The lymphedema clinic will also teach you some exercises. So don't be afraid to move your leg because keeping it still will make it swell up a little more permanently. If at any point during your stay home from discharge you develop a cut or a tear to that extremity, make sure that you clean it up and disinfect it promptly with perhaps a light antibiotic ointment. But again, I cannot emphasize the importance of going to the lymphedema clinic because they will help you to wrap this up in special bandages, and that will cause the fluid to go back up into your system, and it will help that leg to decrease in size. So, having learned that there is a way to manage this lymphedema, how do you feel about your new diagnosis? Well, that's good. There is hope, isn't there? And your husband is here. He seems very attentive. Do you think you will be able to help your wife as far as looking for signs of infection to that extremity during her care at home? Yes, it's very good that you are willing to be supportive. All right, next page on the flyer is really references that the people that put this flyer together have. Do you have any questions, any concerns at all? The phone number to the clinic is in the package that I will be giving you, so make sure you call them for an appointment. And then, like I said again, if you have any questions at all, we're here. Our phone number is also going to be on the discharge packet, but make sure that you care for yourself. And feel free to share the information that you've seen in this packet with the rest of your family members back home. One thing I wanted to point out, again, just to clarify, is that there are 4 different stages that lymphedema can be found. You are in stage 1. In order to prevent your leg from looking like it does in stage 4, you're going to have to make sure you follow up with the lymphedema clinic and listen to the teachings that they give you, as well as elevating your limb, cleaning it, and moisturizing it. Okay? If you don't have any other questions, then we can go over and talk about the rest of your discharge instructions. Thank you.